Vernet syndrome, also known as jugular foramen syndrome, is a rare disorder characterized by dysfunction of the cranial nerves 9, 10, and 11 due to compression of the nerves as they traverse the jugular foramen. This compression may result from several causes, including primary and metastatic neoplasms, infections, vascular lesions, and trauma. As Vernet syndrome is a rare disorder, the available literature is limited and consists predominantly of individual case reports. Although the literature is limited, it does suggest that neoplasms of the head and neck are the most frequently occurring etiology. Vernet syndrome is a rare disorder, but it is suspected that the incidence of the syndrome due to skull-base metastases is underreported due to skull-base metastases occurring late in the course of systemic malignancy, often going undiagnosed. Primary cancers that are most likely to metastasize to the jugular foramen include those of the breast, lung, kidney, and prostate. The disease progression and prognosis is dependent upon the cause of the jugular foramen compression. Benign tumours such as parangiomas have a slower disease progression, and depending upon the location, complete surgical resection may be possible. Metastatic tumour survival rate is dependent upon the status of the primary malignancy and the extent of the other systemic metastases. Compression due to vascular and infective causes often have a more acute onset of symptoms and can respond adequately to appropriate treatment. Continued lower cranial nerve palsy is often associated with the majority of cases involving trauma. Vernet syndrome patients may present with a variety of symptoms, including dysphonia that can be either persistent or positional in nature, dysphagia, loss of taste, weakness in the sternocleidomastoid and trapezius muscles, persistent periauricular pain, and headache. Upon examination of the cranial nerves, clinicians should take note of the following signs: unilateral paralysis of the soft palate, deviation of the uvula towards the unaffected side, unilateral paralysis of the vocal cords, loss of taste to the posterior third of the tongue, loss of the gag reflex, reduced parotid gland secretions, reduced power of the sternocleidomastoid and trapezius muscles, scapular winging, drooping of the shoulder, and the presence of a vesicular rash on the mouth or external auditory canal involved with varicella zoster infection. Rarely, patients may also show signs of glossopharyngeal neuralgia syncope syndrome. There are a number of syndromes associated with compression of the lower cranial nerves, and a thorough examination must be performed to distinguish which nerves are involved in order to form a proper diagnosis. Conditions that may be considered in a differential diagnosis include Collet-Sicard syndrome, which results from compression of cranial nerves 9, 10, 11, and 12. Patients with Collet-Sicard will also exhibit symptoms involving the tongue due to the involvement of the hypoglossal nerve. This will present as deviation of the tongue towards the affected side and atrophy of the tongue muscles. Vernet syndrome, which involves cranial nerves 9, 10, 11, and 12, with the presence of ipsilateral corner syndrome. Tapir syndrome, which results from compression of cranial nerves 10 and 12. Patients may experience dysphagia and dysphonia, as with Vernet syndrome, with the addition of tongue deviation, but not the weakness in the sternocleidomastoid and trapezius muscles. Schmidt syndrome, which involves the vagus nerve and the spinal accessory nuclei, and Avellis syndrome, which involves the unilateral vocal cord and soft palate paralysis, as well as loss of pain and temperature sensations on the opposite side of the body in the neck, trunk, and extremity regions.
Hi Adam, I'm just going to do a cranial nerve examination on you today. Are you happy for me to proceed with that?
Yes.
Yes, okay. So have you noticed any changes to your sense of smell?
No.
Okay. And have you noticed any vision changes?
No.
No? Do you wear glasses?
No, I do not.
Okay. And have you noticed any black spots, floaters, spider webs, gaps in your vision or anything at all?
No.
Okay. So I can get you to read for me the smallest size print that you're capable of reading.
PEZOLCFTD.
Wonderful. And what I'm going to do, I'm just going to have a look at your eyes and I'm just going to be assessing for symmetry. So I'm just looking for any ptosis of the eyelids, exophthalmos, endophthalmos, nostrils are the same size. There's no deviation in the primary gaze. That looks good. And then I'm just going to do a light consensory and direct pupil examination. So what I'm going to do is I'm going to shine a light into your eye, and I'm just going to look for constriction of your pupils. Okay? And I'm looking for the direct reflex, the eye with the light will constrict, and then the consensual, the opposite eye will also constrict. Great. And then if I can get you to, for me, just follow my pen. Don't move your head, and just follow with your eyes. And can you just let me know if you have any double vision, please? And while I'm doing this, I'm just going to be assessing to see if there's any nystagmus. Great. And then what I'm going to do is I'd like you to look behind me at the wall, and then I'd like you to look back at the pen. So look at the wall, and then back at the pen, and back at the wall, pen, the wall, and pen. And again, I'm just looking for any nystagmus. Great. And now just back to neutral. I'd just like you to focus on the pen. I'm just going to bring that towards your face, and just follow with your eyes. Thank you. Great. Then what I'm going to do is I'm going to assess you for strabismus. So what I'm going to do is I'm going to cover your left eye. I want you to look at my right eye, and just keep looking here with both eyes. I'm going to uncover. And I'm just looking for any deviation. So this time I want you to look at this side for me. Great. And then we're going to do a visual field test. So what I'm going to do is I'm going to hold my hands up at the side, and I'm going to wriggle a finger. And I just want you to tell me whether my left or my right hand is wiggling or both are. Okay?
Right, left, both, right, left, both.
Wonderful. Now, same idea. I'm just going to be assessing for any defects in your vision. So I've got a red and a white pom-pom, and what I want you to do is I'm going to bring them down into your field of vision, and I just want you to let me know when you see them and what colour you're seeing. Okay? So just looking directly at me.
Red, red, white, white, red, white, red.
Great. Then we're going to assess your trigeminal nerve. So what I'm going to do is I'm going to test two sensations on you, sharp and soft. This is what sharp feels like. This is what soft feels like. So if I can get you to close your eyes for me, and then I'm going to test these sensations, and I just on your face, and I just want you to tell me what you're feeling, okay?
Soft, sharp, 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 soft, soft, sharp, sharp, soft, sharp, sharp, soft, soft, sharp, sharp.
Great. Then what I'd like you to do for me, I'm going to just put my hands on your face if that's okay.
Mhm.
And if you can just clench your teeth for me. Wonderful. And again. And if I can get you to open your mouth for me, and I'm going to push down. I want you to resist again up, and I want you to resist again. So resist. Great. And I'm going to push to the side. Open your mouth again for me. I'm going to push to the side. I want you to resist. Great. And so on this side. Perfect. And then I'm going to get you to open your mouth again for me, please. And then I'm just going to hit my finger with this hammer and just test your jaw reflex. Okay. Perfect. And with the trigeminal nerve, we would normally test the corneal reflex So with the facial nerve, I'm just going to get you into that surface symmetry first of all, and that's all good. I can get you to raise your eyebrows, great, and squeeze your eyes shut. And then try open those ones, great. And if I can get you to puff out your cheeks for me, please. And I'm just going to push, perfect, and smile, and make a kiss, perfect. And then I'm going to test your hearing. So I'm just going to, can you hear this? Oh, have you noticed any changes to your hearing?
No.
No, okay. Can you hear this?
Yes.
Can you hear this? Right. So what I'm going to do is I'm going to hit this one, and it makes this noise.
Mhm.
So I'm going to hit it, and then I'm going to place it on behind your ear. And then what I want you to do is tell me when you can no longer hear that, and then I'm going to bring it in front of your ear, and I want to tell me if you can hear that noise again. Okay? Again. I'm going to do the same thing. I'm going to hit this, and I'm going to sit it on the top of your head, and I just want you to tell me whether you can hear that sound in both ears, one or no. Okay?
Both.
And it's even?
Mm-hmm.
Great. Okay. So next, if I can get you to just, have you noticed any difficulty swallowing or anything like that? No? Okay. If I can get you to cough for me. Great. And no difficulty swallowing. So if you can just repeat after me, red lorry, yellow lorry,
Red lorry, yellow lorry,
baby hippopotamus.
baby hippopotamus.
Wonderful. Now what I'm going to do is I'm just going to look inside your mouth, and I'm just going to be assessing for any asymmetry. So I'm going to look for, open wide for me and stick out your tongue. I'm going to look for uvular deviation, if you can say paralysis of the vocal cords, and asymmetry in the soft palate. I'm just going to test your gag reflex. Yep. And then if I can get you to stick out your tongue for me, please. Wonderful. So I'm just looking for tongue deviation and any atrophy in the tongue muscles there as well, which is all good. And then what I'd like you to do is if you can shrug your shoulders up towards your ears, and I'm going to push down. I want you to resist against me. Wonderful. I want you to turn your head this way, and I want you to push back into my hand. Wonderful. Turn your head this way and push back into my hand.